The national health insurance has been a topic of debate for quite some time now. It's a financing system which aims to ensure that all South Africans have access to essential healthcare, regardless of where their employment status and ability to pay. A medical academic from the University of Cape Town, Steve Reid, joins me now on the line to discuss what impact this will have, especially during the COVID-19 pandemic. But Steve, very good afternoon. Let me start by asking you, what have we learned so far? Because we know that the National Health Insurance, NHI, is meant to be in place to bridge the divide between those who have and those who have not. What have we learned between those two groups during this COVID-19 pandemic so far?
Well, good afternoon, Tony, and to your listeners. It's good to resuscitate this discussion, which has somewhat been put on the back burner by the COVID epidemic. And what we're seeing is that the NHI is a kind of ideal that we'd all like to happen, but what we're learning with the COVID pandemic is that things have been highly centralized in terms of the planning, and maybe that was appropriate in the acute crisis situation. But as we transition from the acute crisis to a new normal, we have to involve communities much more, rather than getting communities to just comply with prescriptions from on high. We have to get people behind this epidemic, and there's fascinating evidence that the Ebola epidemic, for example, was eventually brought under control by the communities themselves when governments were clearly failing to intervene appropriately. So we have to get communities activated and working constructively to deal with the public health measures that will eventually bring this pandemic under control.
When it comes to the NHI, this basically means that all South Africans should be able to walk into a hospital, a clinic, and the finance should be made available for everybody to, if they need assistance in any clinic or hospital. So the next question has to be, do we have when we look at our health system, do we have the expertise and the infrastructure to handle this?
Absolutely, we do. If you look at it across the private and public sectors, and by the way, there have been amazing collaborations between private and public over the last few months in bringing all the resources to bear that are available. And we need more of this, so that the NHI parallels the process of the COVID epidemic and the responses to it, because we're seeing what's possible when people actually work together around a common vision. But it needs to be from the bottom up and not just from the top down.
I mean, that's a phrase that's going around at the present moment, from the bottom up instead of the top down. Just explain that to me about the bottom up scenario.
Well, the bottom-up is what you and I are doing every day. We're isolating, we're wearing masks, we're washing our hands, and we're keeping surfaces clean and keeping social distance. That's bottom-up work that every single citizen needs to do. But communities could do even more. They can self-organize. And once people understand what needs to be done, there's enormous energy and potential in communities. And we can't expect it all to come from the Minister of Health every time we need to make a change. They need to, I think, listen to what communities are doing and could do to look after themselves. And this is what we've seen in various other epidemics around the world in the past.
Steve, lastly, when it comes to the NHI, everybody, those who are opposed or those who, may not will feel that from a financial point of view, South Africa cannot afford an NHI. Where's the funding going to come from?
Look, we're way past the stage of whether an NHI is needed or it's going to happen in some form or other. This country, if you compare to other middle-income countries similar to ours, Brazil, Thailand, etc., we've got the resources. if you pool them around the common vision for the whole population, we have enough resources. That's a red herring. I think what we need to do is pull together, and I think the COVID pandemic and the response to it is showing us how.
Sorry, Steve, I lied. I said that was the last question. Just a quick one. When we look at the response right now to COVID-19 and we look at the testing, a lot of testing has been taking place. It's been private testing. It has been pretty costly. Then the government stepped in. When the government pushed in now and they started testing, they're testing more and more and more people. Then you can see, just opposed to your private medical care as opposed to your government medical care. Do you think, when you look at it from that point of view, where will the private sector, the private medical care, stand after NHI is introduced?
Well, as we've seen, the private sector has the capacity. In this case, for the testing, they also have a lot of the capacity in terms of human resources. So I think it's about solidarity. It's about those who have the resources actually sharing it with those who don't have the resources. And there's more than enough for everybody if it's equitably distributed. So that's my perspective on it. I think it's obviously up for debate and people have their viewpoints, but we have the resources.
We have the resources. Thank you so much, Steve Reid of the University of Cape Town, talking to us about what we may have learned from COVID-19 when it comes to the introduction of the National Health Insurance, which is surely going to come sooner rather than later.